Therapists of Reddit, what have been the most manipulative things done by incredibly difficult patients? Licensed therapist here. Not a difficult patient, a difficult family. This may not be an answer to the exact question, but what I found is that the identified patient is often a symptom of the dysfunctional family. When I worked at a child mental health/behavioral health inpatient unit, we had a family bring in their kid due to aggression, threatening to kill their siblings/parents, self-harm and suicide threats, etc. Obviously he was admitted. Now part of our program was daily contact with parents by the team and 2x/week family meetings with the team and kiddo. We couldn't get in touch with the parents, however. This isn't terribly uncommon early on. Many families with highly behavioral kids will kind of withdraw after admission because they need a chance to breathe. It doesn't sound right, but it's understood. Problem was, we went 7 days without hearing from them. They didn't call or visit, kid called home repeatedly and no answer, etc. We finally got in touch with them after 10 days, by now child protection was involved as it was considered child abandonment. When they answered the phone they said, "Oh. Well, we're in Las Vegas. We won a 2-week trip on the radio the day before we dropped him off with you. We'll be back in a few days. We'll pick him up then." Our patient turned out to be one of the sweetest, most well-behaved, polite young kiddos I ever worked with. His family was a nightmare. He obviously didn't go back to them. He went to foster care. Parents tried to sue the hospital, the unit staff, the local child protection workers, the county, etc. It never went anywhere. I think about this kid often and it was almost 10 years ago. I'm a marriage and family therapist. I once had a client tell me he had cancer. Even faked walking with pain as he came in for a session after half his colon was removed. I did some research and it turns out the whole thing was a lie. He mentioned doctors and diseases that didn't even exist. I continued to treat him through the lenses that he was after some sort of validation from me or the world. I did not confront him on the lies but allowed him to feel comfortable telling me what he was ready to tell me. He never did reveal any dishonesty in the end, but he continued to come to the sessions, so I assume he was getting some benefit from it. Most of our sessions were centered around some childhood trauma, that also could have been a lie. I eventually had to terminate and refer him to another therapist because I moved. I wish him all the best in life still. Most recently, it's a tie between someone testing positive for meth because she was walking barefoot and stepped on a needle that had to have had meth in it, and another testing positive for opiates because she picked up an unknown pill in her home and it melted in her hand and that's why she was positive for opiates. Both of course denied using. Behavioral health provider here. I've worked with youth under 21 in an outpatient program for the last 4 years. I worked with a young person who, as this thread has pointed out, has many borderline traits. He had been exposed to drugs in utero, and experienced a lot of bullying and other traumas, so certainly not his fault, but still challenging to cope with. Anyway, he was adopted and had been with his parents for about a decade. He had a friend at school who was in a group home, and he had come to the conclusion that being in a group home would mean he wouldn't have to deal with as many rules as he did in his adoptive parents' home. One session the client then began making random allegations about his adoptive parents, everything from denying him food, beating him etc., presumably with the intent of wanting to disrupt his placement. I was suspect of his claims, but as a mandated reporter I am required to report any claims by a minor about suspected abuse. It is not my role to prove it true or false, just to notify CPS, and notify the family that I needed to make a report. I reminded him of this expectation as we had our session, and instantly his facial expression changes. He tells me, "You're not going to tell anyone." I made it all up, just like I'll tell people that you touched me and asked to touch my penis if I find out you made the report. I immediately told his caregivers that I was reporting, along with his threat, as well as immediately calling my manager to let her know what happened. Needless to say, I was never alone with that kid again to ensure he never had an opportunity to make false allegations. Therapist here. I think the situations that stand out to me are parents of teens being a bit manipulative. The teens are my clients. They would lie about needing a letter about their child for one thing when really they wanted to use it to get their child out of some consequences/punishments at their school. Or parents emailing me to ask me to get little Johnny to do XYZ, anything from eating more vegetables, go outside more, not be friends with so and so. Basically asking me to do the parenting. I make it a policy to show teens any and all emails that their parents send me to avoid secrets. I tell parents about this policy on day one. I'm there to help the teen with their goals, not the parents' goals. Most people lie about something in therapy. I take that as a sign that trust needs to be further established in our relationship, and I don't expect the whole truth right away. I've had people try to push my buttons or corner me in hypothetical situations. If you could choose between having dinner with me or Michael Jordan, you definitely wouldn't choose me. Or, would you leave me alone in your office with your purse sitting out? This thread made me realize I was a bit of a difficult patient, lol. Chronic liar, but my therapist was an angel and would call me out super gently and wouldn't shame me for it, which is exactly what I needed. Lying is so hard to stop doing because of the fear of people getting furious with you. She was so kind and accepting even when 50% of the things that came out of my mouth were lies. She also by coincidence was at an ice skating rink when I was there with friends while also recovering from social anxiety, and while she kept an appropriate distance and didn't engage, I saw her once smile when she saw me order some snacks by myself without help. That was so heartwarming. I wouldn't be half of who I am today without her. I'm not the therapist, I'm the patient. It's my family. My brothers are allowed to call me names and hit me/threaten me, but if I retaliate, they threaten to call police. Police always favor those who do not have, diagnosed, mental illness. My mother is an emotional abuser. My interests were constantly put down. I was wrong for liking science and just thought I was better than everyone else. It hurts most because my teachers love her, they love who she is in public. My psychologist is really great and he's helped me plan to sever ties when I can get out of this toxic household. It's so hard though, brainwashed as a child to think the world of my mother, between school and home. Thinking the way I'm treated was normal. Wait, your parents don't hit you? Isn't a discussion a 5-year-old should have with her friends. A lot of my depression, anxiety, and the like are stemmed from her abuse. I strongly believe she induced some of my anxiety so that she could keep me on a, metaphorical, leash. Fuck you, Mom, I can't wait to get out. Dialectical behavioral therapist here. I predominantly work with people with a diagnosis of BPD, and unsurprisingly it seems as though borderline personality disorder is getting mentioned quite a lot in this thread. I find BPD is a pretty shitty label for what could rather be much more accurately described as having difficulty regulating emotions and tolerating distress, with quite often a history of childhood trauma and or poor attachment. It's just easier to label someone as having BPD, so easy that it tends to become synonymous with what is essentially perceived as having a clinical diagnosis of being a cunt. I'm not a therapist, but my job involves working with someone with untreated BPD. The manipulative behavior never really ends, but I'd say the most difficult situation she puts me in is probably when we're out in public. Usually she's not particularly friendly to me unless she wants something, like she'll ignore me if I try to make small talk with her, but in public all of a sudden she's syrupy sweet. She has a visible disability, so people tend to notice her, and when they do and she's acting all sweet like that, they go AWW. However, protocol requires that I remain as neutral as possible, because if you respond to her emotionally either way bad things happen. But when she acts super sweet to me, and I remain neutral, bystanders will act like I'm the world's biggest bitch. The thing is, she knows this and that's why she does it, because she likes it when people think of her as some kind of poor thing who gets treated so badly. Poor her. She enjoys being a victim. They don't know they're getting played, and I can't tell them because 1. That would be a breach of HIPAA, and 2. Who would believe me anyway? So I stand there and have to let everybody give me dirty looks and make comments to me about how terrible I am at my job, while she stands there with a big grin on her face.